session. We're hoping that the presentation part takes about 40 to 45 minutes, and then we're going to open it up to questions. When it's time to open the questions, we will turn off the recording so you can ask directly to the faculty and students any questions that you may have. My name is Betsy Davis. I'm the Assistant Director for Academic Programs here in the Child and Family Studies Department. And I work a lot with applicants. I'm a fan of the program. I am a fan of our students, and it's wonderful to see the passion that you're bringing and then all of the passion that people, when they graduate, go out into the world. I will turn it over to Dr. Chu now to talk a little bit more about today's session.
Great. Hi, everyone. I'm Dr. Chishin Chu. I'm the program director of the Rehabilitation and Mental Health Counseling Program. And join with me, we have several faculties and one student representatives here with us today. Then I will let faculty introduce them briefly and their role. Dr. Buckles.
So I'm Dr. Buckles. I am a licensed mental health counselor and an associate professor of instruction here at USF. I am also the director of the Addictions and Substance Abuse Graduate Certificate concentration in the program. And so I'll be talking a little bit more about that later and how you can choose that route. I've been here at USF for going on almost 6 years now. And so it's a wonderful program that presents students with a lot of great opportunities, and it's really nice to meet everybody today.
Great. Dr. DiPeppo.
Hi, everyone. My name is Dr. DiPippo. I'm also an associate professor of instruction here, and I'm a licensed mental health counselor, so I have a part-time private practice in addition to my duties here at USF. And I also oversee, I'm the director of field placement. I don't know what happened, but I'm the director of field placement. And so whenever you get to the field aspect where you're out in the community, you're doing counseling with actual clients, I help facilitate that process for students. So looking forward to getting to know you guys better. Thank you.
Hi, Dr. Weinberg.
Well, hello, everyone. I am Rick Weinberg. I am a clinical associate professor, and I've been at the University of South Florida since 1977. So this is my 45th year. Started out as a graduate student in the clinical psychology program across campus. And except for 1 year when I was on a clinical fellowship up in Boston, I've been here ever since. I teach in the Marriage and Family Certificate program, along with a group therapy course and then a bunch of different electives. And I wanted to just take maybe 30 seconds to talk a little bit about history since I've been here for quite a while. The program is in its 50th year, so I knew some of the people who were here at the very, very beginning. And historically, the program really came out of what was called in those days the humanistic movement in behavioral health, where the best was seen in people, and clinicians wanted to bring out people's best potential. And while all of the founders of the program are long since retired and some are no longer with us, I think that that atmospheric condition of being very positivity oriented and wanting to see the good in people and bring out the best in people and create relationships in the best possible way still remains with us today. So thanks for being here. Good luck with your applications, and I'm probably going to take off in just a few minutes, but if you have any questions or would like to hear more, please feel free to email me. I'm at Weinberg, that's my name, WEINBERG @usf.edu. Good luck, everyone. Bye-bye now.
Thank you, Dr. Weinberg. You can find Dr. Weinberg's email in the chat. Monica? Is Monica there? Is she here yet?
I don't know if she's here yet. I will send her an email, but we can move on, and then when she
Okay,
comes, we can
great.
let her.
Next page, please. So this is the agenda today. So I know Bessie said hopefully we can finish in 45 minutes, but I'm more ambitious than that. I wish we can finish in at like 35 to 40 minutes. So we have a lot of time for you guys to ask questions. But this is the agenda for today. We will talk about the admission, and I will brag about our program a little bit. And then we get to talk about what potential careers that our graduates will do. And then go through the academic, what to expect in this program. And then Dr. DePepper will talk about field placement. And then we will provide some brief information about how our students receive their licensure. And then Bessie will go through the application process. And Dr. Buckles will talk about the certificate program. And then most interesting to you, right, the tuition and scholarship opportunities. And then we will go to Q&A. Next page, please. So this is the statement of our program. So probably just from reading the title of our program is actually not a traditional mental health counseling program. And our mission is strongly focused on promoting quality behavioral health care for all, especially including people with disabilities. So when we talk about disabilities, including psychological, physical, developmental, all kinds of disabilities and chronic illness. And we are really committed to train qualified counselors to meet the state and national needs. As you know, in the field right now, mental health counselors and rehab counselors are really in great demand. Next page, please. Yes. So yes, this is my favorite slides. I get to brag about our programs. So first of all, our program is CACREP accredited, and we are dually accredited for clinical mental health and clinical rehabilitation counseling up to next year. So this year we are actually in the review cycle. So we are committed, and we are really positive that we will get a full accreditation again. But the accreditation is up to next October. But as you can see, Dr. Weiber just shared that this is our 50th anniversary. So we provide a good program. There's no question that, of course, not 100%, but I am confident that we will get reaccredited as well next cycle. The next thing is that you can see that our graduates obtain jobs, right? So we are celebrating our 50th anniversary. So you can see a lot of our alumni become employers or clinical directors in the community agencies or become private practitioners. So a lot of jobs, and I don't see people coming back saying, oh, it's really difficult for me to find a job. So when you graduate from this program, the degree really speaks for itself. Like when you say you graduate from our clinical mental health and rehab counseling programs, people usually know. And for those people who are already working as a behavioral tech or in behavioral agencies, you probably know some of our alumni. They are everywhere in the Tampa Bay area. And then another highlight is that our clinical faculty are seeing clients on their site. So you get to learn from her firsthand, and they have the up-to-date information, and they are practicing themselves every day. And in terms of our faculty, our tenure track faculty, if you are interested in doing research, our faculty hosts national office in professional organizations, and we receive millions and millions of research grants every year. So if you are interested in research, I think you will also be in good hands. And then we are actually one of the few programs in USF that actually rank in the top 50s. So when you are walking on campus that you are from our program, you should feel very proud. But overall, we provide quality training, and our students very satisfied with the program itself, because for the accreditation, every year we have to do exit survey for our graduates, and then we also follow up with our alumni. So overall, this is a good program. So in terms of careers, rehabilitation counseling and mental health counseling is a really broad profession. So you can work with private practice, you can work in private profit or private nonprofit organizations. But I will invite Dr. DePepos to talk about mental health counselors, like some of the, just give them some examples about what mental health counselors do.
Okay, I'm trying to turn my camera back on and it's, okay, am I back? No. All right, sorry. Takes a little while. So for your license as a licensed mental health counselor, you can do a variety of things. You can work in agency settings, whether it's substance abuse, strictly mental health, hospital settings, and where else do we work? School settings. And then a lot of people also do private practice. So if you want, or group practice for that matter. And there are so many opportunities with a license. It really opens the door to do many things. So again, a variety of possibilities.
Great, thank you. And for some of you may be interested in rehabilitation counseling, again, it's a very, very broad profession. You can work with the state agency or VA hospitals, or in any private or public agencies that provide vocational evaluation or case management, or even provide like a lot of like work-related supports. And I also want to invite Dr. Buckles, what do you say about being a MCAT?
Oh, that is wonderful. So MCAP stands for Master Certified Addictions Professional. It is a credential. Again, as we go into plans of study, I'll talk a little bit more about with the certificate option here in our program, how it prepares you for state level certification. It is basically another feather in your cap. It shows that you have an understanding in treating individuals with addictions and substance use disorders. This can range from behavioral addictions like eating disorders, gambling, internet, gaming kinds of addictions, up to substance related addictions, alcohol, opioids, things like that. It doesn't pigeonhole you into working with substance abuse, because I know sometimes people feel like, well, if I get this credential, then are they only going to identify me for substance use jobs? No, you can still work in mental health fields. You can, work with families. You can work with couples. You can have the diversity of population, but have that specialty and that credential that kind of sets you apart as somebody who also knows not only your LMHC, but also knows and how to work with those with addictive disorders. So it can open additional doors. In substance abuse specifically, there's all sorts of levels of care that you can do. You can do outpatient treatment, prevention, and residential care. So if you're interested in working in populations that are there 24/7, which is a very unique experience, then you can work in residential populations. And if you're more in the outpatient setting, you have that opportunity as well with substance abuse. So.
Great, thank you. Next page, please. So this is our degree options. So if you are not very sure what track you want to be in, the general track for students graduate from the general track, they will receive MA in Rehabilitation and Mental Health Counseling program, and you will be eligible to become licensed mental health counselor or a certified rehab counselors. What is different this year would be the new cohort coming in the program. At the end of their first semester, they will need to select whether they want to go on mental health track or rehab counseling track. There's a potential to cross over, but they will need to do a separate internship. But the details, we can talk about that if you are interested later in the Q&A, or you can contact me and I can tell you about that. And then if you select a substance abuse certificate, you will be eligible to become LMHC or CRC and a MCAT. And I know, and you probably, some of you are interested in the MFT certificate. For the marriage and family therapy certificate, we revamped the program. So now, right now, for students who are in the RMHC programs, select MFT certificate will not be eligible to become licensed marriage and family therapist, because the law has changed in the state, and you have to have at least 250 relational hours. And it's in the rehab and mental health program, we don't have that infrastructure for you to complete those practical hours. That's why you won't be eligible, but you will still be able to obtain all the knowledges and training regarding to work with family and couples. Okay, next page, please. Oh, sorry, can we go back, Bessie? I forgot to mention about the non-thesis or thesis track. So for all these tracks, this is non-thesis, but for some students, if they want to do thesis, there will be options there as well. So when we go to the next page, I will explain that more. Next page, please. Oh, not here, but later we will talk about that. So you can come to the program as a full-time or part-time student. Typically for full-time students, they take 3 to 4 classes per semester, and you will be graduating with 2 years plus 1 semester. But for those 2 years, you also need to take classes in summer. This is a total 60 credits program. And for part-time students, you take 2 classes per semester, and usually you finish in 3 years plus 1 semester. And there's a potential, and people do that. Sometimes they feel like they have full-time job, they may not be able to manage. So they start a part-time, and then once they get in the program, they become full-time students and finish earlier. But some students, they start full-time and then they get a job, and then they could up to become a part-time students as well, as long as you complete your program within 5 years period. Next page, please. So this is the academic. So there are 42 core credit hours. Regardless your track, your certification, there are 42 share credits that everyone takes. And then in terms of the 6 credits of electives, that's where when you are in substance abuse certificate program or marriage and family certificate program, you get to select classes that you like to concentrate, and they will count toward your degree program as well as your certificates. But if you are elected to do a certificate, you may need to take 3 more credits. So you will be graduating with 63 credits. And there are 12 credits requirements when you are doing your practicum and internship, and Dr. DePepo will go through more detail later. Next page, please. So this is just an overview of a general track class plan of study. So you can see that you have to take 3 to 4 classes every fall, spring, and semester is typically lighter load. And then we want people to really focus on their internship because it's kind of like a full-time job. That's where sometimes people have to, not continue to work at the time. Okay, next page, please. So Dr. Buckles.
Okay, so this is the plan of study with the ASA Addiction Certificate. So to give you a little background on the Addiction Certificate, the certificate is 15 credits. And what we do is 2 of those 5 courses are in your general track. So your practicum and your fundamentals of substance abuse, all students take those 2 courses. And then there are 3 other courses that you see: the professional skills for addictions counselors, counseling approaches, and addiction to special populations. Those 3 courses are designed around the education requirement for the state board. So what the state board requires for an MCAP is they have 350 content specific training hours that they look in 9 different areas. And so these courses are designed to help you meet all of that content specific training. From there, it does require some field experience, very similar to licensure. So it's 4,000 hours, but that's hour for hour. So every hour you're working is counted towards that 4,000 hours. So that's approximately 2 years, very similar to licensure. However, the difference from licensure is you can actually count your practicum and internship hours inside our program towards state level certification. And if you were to find employment in the field in substance abuse, which many students inside the certificate program do, then you would also be able to count those hours towards that 4,000 that you're working towards for master's certified addictions professionals. What this basically does is it gives you the skills to know how to navigate the field of substance abuse, to work with individuals who have addictive disorders, how theory conceptualizes those with addictive disorders, what counseling interventions would be appropriate, and then also working with, excuse me, special populations like domestic violence, trauma, and substance abuse, and communicable diseases, because those are kind of big areas that go along with addictions and substance abuse. So if anybody has any questions on the certificate and what it looks like, and what types of things you might be learning in the program and the benefits of having it, please feel free to reach out and email.
Dr. Buckles, I think you're muted.
Yeah, how long was I muted?
No, not just the last sentence, I think.
I noticed that, and then I was like, was I muted the whole time? Thank you.
Okay, so the next is the marriage and family certificate. So the marriage and family certificate plan of study actually is similar to the substance abuse certificate program. And Dr. DePepo and Dr. Buckles help me if I miss some of the informations. But this is the MFT certificate is also a 15 credits certificate, and 2 classes are actually already part of the degree program, which is the human sexuality, and I want to say, which one is the other one?
I thought it was foundations, but I'm not sure.
Yeah,
anymore.
so
I think it's going to change to the trauma-informed care as we move forward.
Oh, got it. Yeah. Okay. So there's a new classes that will be part of the degree program, but you already have 2 are actually in the existing degree program, and MFT is more flexible. So there are different elective courses that you can choose from. There are Dynamics of family therapy is actually required for the certificate program, but practicum 2, marital family, there are also the trauma-informed care is another option, and they also have a class in adolescent behavior, I believe. But again, if you are interested in the program, please contact either Dr. Weinberg or Dr. Henry. And Ryan Henry is actually the director of the MFT certificate program. Next page, please. Dr. DePepo.
Sorry for the delay. My camera takes like 3 or 4 times to come on. So field placement, this is a very exciting part of the program. This is where you get to put what you're learning in class into practice. And you will have 3 different classes for field placement. You'll have practicum 1, practicum 2, and also internship. We have over 100 field placement partnerships in the community, ranging from the Tampa area, Sarasota, Pinellas County, north of here, Pasco County. So we have partnerships all over the place. And what you would do is you would be at a site for a certain amount of hours, which I think is on the next slide, and then also attend a class where you're getting group supervision, talking about your cases. What's really cool is 50% of our students are employed in the field by the time they graduate. Oftentimes, our students at their sites, the sites recognize how great they are and end up hiring them, particularly for internship, which is pretty cool. And something to keep in mind is that we also offer field placement fair, whether it's virtual or in person. We haven't hosted the in-person fair since COVID, but hopefully that will come back. And that's where we invite the agencies to come on campus. They host a table, and you get to talk to each and every one of them and learn more about what they do. Next slide, please. Yes, so here is the breakdown of the classes. as I mentioned, you have practicum 1, practicum 2, and internship. And you need to reach a total of 900 hours overall. For practicum 1 and 2, the hours are the same. You would be at your site for 10 hours per week. It would be 15 during the summer. And for internship, you would be at your site for 40 hours per week over the span of the semester. So that is, internship is the last class that you take in the program. So it's important, knowing the hefty hour requirement, that you plan appropriately for that time. And again, this is where you're putting everything that you're learning into practice. Next slide, please. And then Dr. Chu, would you like me to talk about the path to licensure as well?
Yes, please.
Yes, great. Okay, so once you graduate, you don't automatically have your license. There are still steps that you need to take in order to become a licensed mental health counselor. So getting your degree would be that first step. Then you would register with the Florida board as a registered intern with the state of Florida. Once you register, you have to complete 1,500 clinical hours. And that can be done in no less than 2 years and no more than 5 years. Now, what's important to note is that when you're collecting and accruing these clinical hours after graduation, you're working in the field, you're getting paid. So it's not like 2 years of free labor or anything like that. You will also need to pass a state licensing exam, and you can do that anytime after you've become a registered intern with the state. And there's a few other continuing education credits that you would need to do in order to become licensed. So getting your degree, that's that first step. And then there's these other additional steps that you would need to take. And the reason there's the additional steps is because we are working with a population, most of the time vulnerable population, and we want to ensure that we are implementing best practices and really know what we're doing. So that is the path to licensure as a licensed mental health counselor.
Great. Thank you. And I think before we move forward, it just like struck to me that Monica is here, and she's actually a fellowship recipient from our program. So I would like her to introduce herself and talk a little bit about your experience with the MFT certificate. You are muted.
Oh, sorry, I just realized that. Okay, hi everybody, my name is Monica. I'm in my second year in the RMHC program on the MFT certificate. So my experience with the MFT program has been great. I love the classes that we take, and we get the opportunity. We have a fellowship, which is a minority fellowship program with the AAMFC Institute, which is a really great opportunity to get to meet other people in the MFC field and have like professional development training. So yeah, it's been really great. The classes, you have the options between choosing two electives. So certainly we have kind of like some flexibility to choose what we like. And then we can also cater our practicum experience to working with families and couples.
I think I muted myself.
Yeah.
So Monica, how do you feel about like going through the admission process last year? Like we can see here, we have like 40 to 50% of acceptance rate, and typically we have we want to fill 35 to 40 seats. How do you feel about the admission? Was it hard?
It was, I mean, the process itself was pretty new to me because I didn't have anybody in my family who went to grad school. And just getting through like the GRE and, you know, the personal statement and all of that stuff can be a little stressful. But I think it's very much worth it. And I would say like this program has been, and I'm not saying that just because, you know, we're in this session, but me and my, you know, peers in the class really do feel supported. Once you enter the program, you're assigned an advisor, which you can reach out to for anything that you need, and then you're assigned a peer mentor, a student mentor, which I'm a student mentor myself, so we get that support from each other, which is really helpful.
Yeah, thank you so much. Yeah, you really provide great service to the program. Okay.
Yeah, and I can leave my email if anybody wants to ask anything about the process.
Yeah, sure. Yeah, you can leave that in the chat. Next page, please. So Bessie.
Okay, everyone. Well, I'm so happy that Monica's here because we've been talking a lot about the nuts and bolts of the program, but it's really the people and the students and the clients that they serve that really make the program so special. So hopefully at this stage of the game, you've either started an application or are really excited to start one. So I'll just share with you a little bit about the process. So you'll see that we require a resume, a statement of purpose, 3 letters of recommendation, one of which we ask is from a former professor or instructor that you took in college, GRE scores, and your transcripts. If you happen to be a USF student, you don't need to provide our transcripts because I can access them. And then finally, a couple of forms, background information that you need to sign, which I will send to all of you at the conclusion of the session. So that's what you need to submit to us. And then in order to be considered at our priority deadline, it's January 15th. Everything needs to be into us by that time. So typically the GREs and the letters of recommendation take a little bit longer. So I'd recommend trying to get that done before the holiday season as much as possible to give especially your recommenders time to write really thoughtful, exciting letters on your behalf. So we'll review after January 15th, and then we will invite a select amount of you in for interviews so you can get to know us better and we can get to know you better. So that's sort of the basics of what we do. And then I also included some screenshots of where you find the application and how you actually apply. So if you go to our homepage, you would click the clinical rehab and mental health counseling tab and then hit the admission tab. And then at the bottom of the admissions page, there's a place that says apply now, and that will bring you over to the Office of Admissions website where you'll create a profile that you can go back to and update your application as you get more elements completed. This is also where you will put the email addresses for your recommenders in, and then this portal will send an email to your recommenders inviting them to create a profile and to submit their letters that way. And this is an important step because in order for us to accept the letter of recommendation, it needs to come directly from the recommender and not uploaded by you. So that's just something that has held up applications in the past. I wanted to draw attention to it, but really we look at every single application. We review holistically. The statement of purpose is really important and we want to get to know you. So I don't know, Dr. Chu, if you have other things that you'd like to add as far as tips for the application.
I think I think I agree with what you say, that we are actually looking at the holistic application. So if you have like particular questions about your application, feel free to reach out and we will assist you.
That's right. Okay, so then the next slide is just to talk about the tuition and scholarship. So you'll see at the bottom of this slide what the in-state and out-of-state tuition per credit cost is. But then we also, the reason why we have a picture here too is that we do our best to help our students apply for USF specific scholarships, graduate assistantships, teaching assistantships, and also external fellowships like what Monica talked about, the National AAMFT Minority Fellowship. We have students that have secured that. We're on a roll for, I think, 4 or 5 years in a row. We've had students that have gotten that and other national scholarships that provide generous stipend as well as professional development. So we really try to do whatever we can to help our students succeed. And then Dr. Chu is actually on the grant writing team for several specific scholarship training grants for our students. I don't know if you want to talk about that a little bit too.
Yeah, sure. So for the RSA scholarships, it's really for people who are interested in working with people with disabilities. So this is a federal grant, and you get around like $23,000 or $24,000 as a whole, and you will get paid for 3 semesters that will directly pay to your account. The only there's a binding requirement is that you have to commit to work 3 years in the state agency or any state agency vendors for 3 years. So that's the requirement for this scholarship. And each year we have around 6 to 8 openings. So you will be able to apply to it, but you don't need to apply to this scholarship before you come to this program. No, I, you just need to contact, and then I will tell you when the due date is, because from time to time, the starting date of the scholarship is actually in October, so it varies about the timeline. So if you are interested in working with RSA and then you like to apply for the scholarship, please contact me. And we also have HRSA BWET scholarship, and you also don't need to apply to this scholarship before you come in, because this scholarship is really for the last year students that they are interested in working in the integrated behavioral health settings. For a long time, that we all know that people go to their primary care services for their mental health needs. And a lot of people that get referral, but they don't follow up with their appointments, right? So this is also a federal grant that will provide students $10,000 to do a field placement at a primary care setting. So when you come to the program, we will talk about this opportunity, and you will get to know more about this opportunity. And the next thing I would like to talk about is, like, I know graduate school is hard. So some students, they come to the program that they will look for graduate or teaching assistantship. Some of them are just OPS, which means that you get paid hourly, but some of the programs that they actually offer tuition waiver. So if you are interested, you can look on the USF website as well, and a lot of time they have those announcements. And so far, I think lots of our students are successful in securing a GA position in honors college with tuition waiver, and some of them work with other colleges as well. And if you are a state employee or USF employee, there's also employee benefits that you get 6 credits free each semester. And then there's also the financial aid options. So I think I managed to finish this in 37 minutes. So thank you so much for joining us. And I want to open this to everyone for questions.